One of the things I want all of you to know is this is the #1 predictor of breastfeeding success is that you have that baby skin to skin the first 60 minutes.
Hi, my name is Linnay, a certified breastfeeding specialist.
I'm Angela Lang. I'm a clinical nurse specialist and an IBCLC.
And today we're playing What's Wrong with This Picture?
Expectations After Birth Edition.
So let's hop in. Something's either wrong with this photo or nothing's wrong with this photo. What do we have here? Okay, we have some very full bottles. Now let's remember, this is expectations right after birth. What's wrong with this, or is there nothing wrong with this?
Definitely something wrong with this because you would really never get that much milk right after birth.
Right after the first 24 hours, you're maybe doing a teaspoon of colostrum per feeding, where you're not filling up bottles here.
No, especially like we have this little colostrum container that has maybe 5 cc's of milk. So that we're looking at 15 ounces of milk. There's no way you could ever get that much milk right after birth. This is kind of what to expect.
And would you even say this photo is almost an oversupply even later on in the journey?
Yeah, probably. I would say maybe at like 4 or 5 months you would get that much milk, but you'd probably be saving some of that because a baby could never really drink all of that.
Not in one feeding, definitely not.
What do you think, Linnay? Is this a fair expectation after birth?
Let's get a closer look. There's colostrum in these containers.
Yes.
That's a lot of colostrum though, but it depends on like how after birth we're talking about. 24 hours, 3 days.
I would say that's the second or third day. So on the first day, sometimes even the colostrum won't go all the way through the pump like that. So on the first day, I would still say you're kind of more 5 cc's. And then now we're moving to the second or third day where you might get 10, 20, or 30 cc's.
All right. Nothing wrong with this photo unless we're looking at volume of colostrum on the first day. But if we're talking a little later on, there's nothing wrong.
You're doing good.
Yeah.
Okay, so what's wrong with this picture?
It looks like we have a personal use pump being used in the hospital. Again, the context is right after birth. Is there anything wrong with this?
Well, you know, what I would say is that in the first 2 weeks, it's really critical to get your milk supply off to the best start. Best way to do that actually is with a healthy term baby. So babies are perfect at programming the breast for even the milk we need even at 3, 6, and 9 months down the road. But if you don't have a baby that's breastfeeding well at the breast, or your baby's in the NICU, or there's separation or anything, the personal use pump isn't a great pump to use in the first 2 weeks. The pump that we have at the hospital, the Symphony pump, actually has a patented technology in it. It's called initiation technology. And what it actually does is it mimics the baby's sucking pattern. So even things that we see babies do, like this little quiver at the breast, and we think, oh, the baby's not doing anything, it's actually doing something.
Yes.
It's actually talking to our brain and telling our brain to ignite the milk-making cells.
Yes.
Now, what's interesting about this in the first baby, right? The first time you're pregnant, your breasts are still actually developing. And so we need those signals to the brain in order to proliferate as many cells as possible. And then if we don't do that, you're not going to make as many cells, and so you'll never get to full volume. Best way to do that is with the Symphony pump. If you leave the hospital and you don't have it at the hospital, you can use that pump. You can rent it at home for at least the first 2 weeks. After that, your breasts move into more like a supply and demand. So as long as you continue feeding babies frequently or pumping frequently, you'll still get a really great milk supply.
There is something wrong with this photo. It's the use of a personal use pump in those first 2 weeks post-birth. What's recommended is baby, or if there's latching issues, is if the baby's taken away due to health issues, you'd then want to pump with the Symphony hospital pump with that initiation technology built in. This personal use pump, which is a really great pump, can be used after those first 2 weeks.
You know, and another good point about that, Linnay, is you really don't need to be pumping if your baby's at the breast. If your baby's doing well breastfeeding, wait about 2 to 4 weeks even to start pumping. A lot of moms want to like get a freezer full of milk. What we want you to focus on in the first couple weeks is just being there for your baby. Try and enjoy your baby. Plenty of time later to stock up some milk. So we're still on expectations after birth, and now we see this picture. Is there anything wrong with this picture?
I don't see anything wrong with this photo. We have a mom that just did a C-section delivery, and that baby is latched on her breast. We love to see that because having a C-section is a factor that plays into initiating your breast milk supply. And sometimes that baby is taken away rather than put on your chest because you have this procedure.
Most of the time we don't plan C-sections. Sometimes we plan them. What you usually happens is there's a separation of mom and baby after the procedure. When we look at actual research and data, the sooner that baby gets to the breast, the better chances that baby has breastfeeding. So in this particular picture, what I love about this picture is it was really after birth because you can still see the surgeons there sewing the mom back up. This is right away after birth. This is also another thing that you can advocate for yourself at the hospital. You'll have to have your whole care team in agreement with it because sometimes people don't feel comfortable in the hospital doing this. The other thing that I would say is that has a blue drape so the mom can't see the procedure, but we have things also called gentle C-sections, so you can actually ask for a clear drape so you can see the baby as soon as the baby comes out. So lots of ways that we can incorporate more of a natural birth experience, even if we're having a C-section. Get the baby skin to skin as soon as possible.
Oh yes, and I love that you said you can ask for that. I think moms forget that you can ask for pretty much anything. We recommend creating a birth plan. It's just really important that you advocate for yourself.
And sometimes it's really the moms that bring these things up that make the providers understand that moms really want these things. Of course, you want to do that in cooperation with your care team. There could be lots of reasons why it wouldn't be feasible, but even with that, the sooner you get the baby to the breast, the better it is for your breastfeeding. So now we're looking at a picture of a baby skin to skin right after birth. What's wrong with this picture?
I don't see anything wrong with this photo. It's so cute. It's adorable. We have skin to skin. Look at that little fist right there by its mouth and on the breast. Never want to wipe the baby's hands or take the baby away. Their hands smell just like the areola and nipple to help find that area so they can latch and breastfeed. So this is just such a great image right here.
And what I really love about this picture is you can tell this is immediately after birth, right? So you can still see the blue draping on the mom and baby. One thing that you all need to know about creating the best milk supply is you want your baby skin to skin after birth for at least 60 minutes. We don't want to take the baby away. We want to keep the baby there, and babies go through a whole process. Like sometimes they're sleeping, sometimes they're moving. You wouldn't believe it, but babies can actually like move their whole head to find the breast. And that's when we're going to get the best milk supply. One of the things that's really interesting about skin to skin is that it looks like we're just like snuggling our babies, but it's actually initiating a lot of hormones for both the baby and the mom. The baby gets more comfortable at the breast. He has better heart rate, better breathing patterns.
Temperature control as well.
Oh, it's so good for temperature control. The baby will go to breast and have that first feeding in the first hour, which is the most predictive of long-term breastfeeding success. So the number one thing, you have to have your baby skin to skin at birth.
And just to emphasize what Angela said about that first hour, that's called the golden hour. That is time for you and your baby to bond, for the baby to latch, and that really does set up a success for you and your baby in your breastfeeding journey. And it's just such a magical hour. So give yourself that time. Don't let anyone take that away from you. If there's no issues or complications happening, enjoy that time, bond with that baby.
After the first 60 minutes, the baby's kind of sleepy. We can wrap the baby up and pass the baby to everybody, weigh the baby, do all that stuff. But that first hour, we want to save for mom and baby. Super special.
All right, what's wrong with this photo? I don't see anything wrong with this photo.
I actually really love this photo. It's so cute.
Look at that positioning.
I know, it's so good. You know what's really great about this, Linnay, is that really in the beginning of breastfeeding, we want to have frequent feeding and early feeding. This actually looks like really early after the birth, which is great. And notice her positioning. You know, one of the things that's the hardest to realize in the beginning with a breastfeeding baby is you actually have to support the breast a little bit. So in this picture, I love that she's like holding the baby this way, giving some support to the neck and shoulders. Yeah, that's a pillow. She's holding that breast up. And that also allows her to do something, a real secret with breastfeeding success in the beginning is to do breast compressions during the feeding. Those babies, when they're new, they're super sleepy and they want to go to sleep. And one of the ways we wake them up is by doing some breast compressions, and then we'll get the milk to start flowing again, and the baby will get all re-engaged with the feeding. And that's how you can get a really full feed in a baby right after birth.
And I love that you pointed out it's not about the volume of milk, but the frequency of feeds.
So really we want early feeding. So trick number one is you want to feed that baby within the first hour. So that's the most predictive of long-term breast milk supply. And we want to get in 8 good feedings in that first day, at least for the first 3 days. Sometimes babies cluster feed a lot and they might eat every hour, but that kind of tanks them up for making a longer sleep. So they might sleep 4 hours after some of that cluster feeding. All totally normal newborn behavior in the first couple days.
Totally. All a mom needs to worry about is eat, sleep, breastfeed, and repeat.
The other thing she's doing here is she has her shirt off, which means she's got lots of skin-to-skin contact with her baby, which is also going to really help her milk supply.
Yes, skin to skin is so important.
So there's nothing wrong with this picture. We love this picture.
Next photo. All right, what's wrong with this? It's very different from that last photo. Very different scenario, but we have a fresh newborn here. So what's wrong, or is there anything wrong with this?
As a labor and delivery nurse, I've brought babies over to the warmer many times. But what's the most important thing is that the mom had 60 minutes of skin to skin before we bring the baby over. And this is an important part of the neonatal assessment, right? We want to check the baby, weigh the baby, take the temperature. As long as this is done after the mom has the first hour skin to skin, then there's nothing wrong with this picture.
Then there's nothing wrong, exactly. You have that golden hour and then you can move.
And it's kind of a good point, Linnea, because all across the country, it's kind of a standard practice that the baby gets to the warmer before it gets to the mom. One of the things I want all of you to know is this is the #1 predictor of breastfeeding success is that you have that baby skin to skin the first 60 minutes. So you can advocate when you go to the hospital and ask your nurse, hey, I want my baby skin to skin with me for the first hour. As long as the baby's healthy and the baby's breathing, there's no problem with that. Now, there could be a time if there's an emergency or something, the baby needs to be assessed differently, then that's fine. As soon as the baby's stable, then the mom gets to have the baby skin to skin.
And a lot of these routine procedures can be done with the baby on mommy's chest.
Yes, I've done assessments, even giving shots with babies skin to skin. And guess what? The babies don't cry as much when they're skin to skin with their mommies and they get a shot. They kind of whimper a little bit and then they're like, oh, I'm with mommy, it's fine.
Yes. Angela and I have so many more tips, tricks, and advice for you. So comment below any questions you have and we'll be sure to answer them.